Hello, everyone. I want to welcome you to our webinar tonight. Feel free to use the chat to introduce yourself and where you're from. And you can also use the chat to place questions to our guest speakers tonight. Again, welcome to our Inspiring Scholarship and Social Change series that our Sigma Phi New Chapter partners with the Walden University College of Nursing. I am Sarah. I am currently serving as the Membership Involvement Chair for our chapter, and I'm excited that you've joined us this evening. All microphones will be on mute so that our speakers will not be distracted. Dr. Sullivan and Dr. Dennison will go through their entire presentations and we will hold questions at the end. So again, you can type those questions in the chat box or you can save them for the end of the presentation. Please note that this session is being recorded and a link will be sent to you after the webinar is completed. We only have two speakers today, but before I introduce them, let's have a few preliminaries out of the way. Some simple disclosures. Our session is jointly provided with the Walden University College of Nursing and our Sigma Phi New chapter. The planners and presenters of this nursing continuing professional development activity disclose that there are no relevant financial relationships, those held by the planner or significant other currently or within the last 12 months with commercial interest. No relationships exist for the nurse planner or presenters which could influence the planning or implementation of this activity. The planners and presenters have disclosed no financial interest nor received any in-kind material that could influence this presentation. Contact hours. Walden University is accredited as a provider of nursing continuing professional development through the American Nursing Credentialing Centers Commission of Accreditation. Walden University designates this activity for 1 nursing continuing professional development hour. Now to get to the exciting part. Today we have 2 presenters, Dr. Hazel Dennison and Dr. Deborah Sullivan. Dr. Deborah Sullivan brings a wealth of experience, passion, and dedication to her role as faculty counselor for our Phi New chapter of Sigma. She's a nurse educator and leader with a career that spans across academia, clinical, and organizational settings. Dr. Sullivan has taught nursing students at every level, LVN, BSN, MSN, and PhD, and has consistently championed innovation in nursing education. She currently serves as the senior core faculty member at Walden University's College of Nursing, where she has taught graduate students since 2014. Dr. Sullivan's scholarly contributions include over 100 peer-reviewed citations and regular presentations at national and international conferences. Her recent work focuses on leadership in nursing, pediatric pain, cultural humility, and the integration of generative artificial intelligence in nursing education. She also recently completed a systemic review on nursing burnout and conducted a study on nurses' mental health during the COVID-19 pandemic. Dr. Sullivan holds a PhD in nursing from the University of Nevada, Las Vegas, and an MSN from the University of Texas at Tyler. She is a certified nurse educator, certified online instructor, NLN HITS Scholar, Tennessee Simulation Fellow, and holds a certificate in the fundamentals of Magnet. Her leadership extends beyond the classroom. Dr. Sullivan is actively involved in multiple professional organizations, including the Tennessee Nursing Association, Tennessee's Nurses Foundation, and the Phi New chapter of Sigma, where she has served in leadership roles for many years. Dr. Sullivan is Very honored to serve as our faculty counselor here at the chapter and eager to continue supporting our chapter's mission by fostering professional development, scholarly excellence, and meaningful member engagement. Her dedication to nursing education and leadership makes her a strong advocate for our chapter. And next up, we also have Dr. Hazel Dennison. Dr. Dennison received her DMP from Rutgers, the State University of New Jersey. Dr. Dennison has been a faculty member at Walden University for over 14 years and is currently a core faculty member in the BSN program at Walden University. Professionally, Dr. Dennison has worked as a researcher in the field of nephrology and has mentored doctoral students at Walden and Purdue universities. Dr. Dennison currently serves as volunteer roles as a faculty advisor for our BINU chapter and as executive director of nursing CPD for Region 5 of the New Jersey Nurses Association. She has written a chapter in a DMP textbook focusing on research methods, evidence-based practice, and QI. Dr. Dennison also wrote in a med-surg textbook. Dr. Dennison has lectured nationally on topics related to professional development for nurses within the field of nephrology. Her interests include running, reading, entertaining friends, and enjoying time with her family. And she is honored to continue to contribute to our chapter's growth. I'm going to switch our PowerPoints here. Give me just one moment. If someone can confirm that you're seeing the PowerPoint from Dr. Sullivan and Dr. Dennison, perfect. I will hand it off to you, Dr. Sullivan.
Okay, great. Thank you, Sarah, for that great introduction. And thank you, everyone, for being here this evening. Tonight, Dr. Dennison and I would like to present to you Empowering Nurses, a Guide to Thriving in the Job Market. Next slide. Our agenda this evening will be career planning and goal setting, resume, CV, and cover letter writing, job search strategies, interview preparation, professional image, licensing and credentialing, and transition to practice. Next slide. So as an introduction, this webinar is designed to equip you with the tools and knowledge needed to navigate the competitive job market and transition seamlessly into professional practice. Next slide. And so this first section is on career planning and goal setting. So we'll be identifying career interests and creating a professional development plan. Next slide. So first, let's talk about career planning. First, you want to evaluate your personal values. Where do you want to work? Do you want to work in an environment that, that pediatrics? Do you want to work in cardiology? As nurses, we have such a huge options of where we want to work. Do we want to work in a clinic, in a hospital? Do we want to do occupational nursing? So there's a lot to think about. What are your values? What's important to you? And then think about job satisfaction. What's going to give you the most value? What's going to make you happy? It's important to think about these things at the very beginning before you do the job search, because things might jump out at you that seem exciting, but do they really talk to you for what you want to do as a nurse? And then think about your goals. Do you think about the short-term goals? Do you want to get experience? Do you want to get your foot in the door to a recognized organization? Do you want to work certain hours? And so on. Think about those short-term goals, and then think about long-term goals. Do you want to continue your education at some time in the future? Do you want to earn a certificate in nursing in some specialty area? Do you want to retire at some point? So you might want to write out your goals, and in terms of like 5-year goals or 10-year goals. And then think about the career opportunities that are out there. And then that's where we can start looking at that. Next slide. So as I was mentioning, specialties, nursing specialties, again, think about, do you want to work in pediatrics? Do you want to work with adults? Do you want to work in med surge or surgery, PACU? Do you want to do outpatient surgery? Or, what sort of patients do you want to work with? Or what kind of nursing? What environment do you want to work in? Do you want to work in a clinic or a hospital? Do you want to work for an insurance company, hospice, or maybe occupational nursing, and so on? So in nursing, again, we have lots of different options in areas and environments that we can work on. So think about what you want. And then again, think about your goals, the short-term, long-term goals. Do a self-assessment test. Are you in a position to work full-time, part-time, or do you want to float? You may want to try out various environments to see where you fit the best. You may want to be a travel nurse. So think about and encourage this. This is just to encourage you to think about what you want to do in terms of of, of your time, the money. What is the pay scale, and what kind of obligations do you have at home? So, for example, you might have children, and so that might influence your goal. Do you want to work just the day shift? Do you want to be home, with your children during the day, or is that not an issue? So, all these things are important to think about before you actually go out and start searching for different jobs. Next slide, please. So, one way to think about what's called SMART goals is the first is an S for specific, and that means clearly define your objectives, and then be sure they're measurable, quantify the progress, and they should be achievable, be realistic about what you can accomplish, be relevant, ensure the goal aligns with your career vision, time bound, set a deadline for completion. An example would be to obtain a certificate in critical care nursing within 18 months. Next slide. So again, creating the professional development plan is part of setting goals. So you'll set a timeline, you'll plan for continuing education and certificates or certifications. You should seek mentorship and networking opportunities as well. Next slide. So some of the challenges. So make sure that you could lack clarity of your career interests. So you can utilize career counseling or coaching services. You might have limited access to mentors or resources, and in that sense, you could join us and find new, but you could also join other professional organizations or peer groups. And then balancing your career goals with your personal life. So break goals into manageable steps. And then resources for career planning are some of the resource tools. Career self-assessment tests are a good way to do that. Professional organizations, again, like us, find new, but there's plenty, especially in your specialty organizations. Continuing education, in your state, you may be required to have a certain amount of hours in certain areas. And then also another resource, it's important to think about a mentorship program at the organization. If the organization has one, that might be a reason to think about joining them. So next slide. So now we're going to talk about resume, CV, and cover letter writing. So this is the opportunity to showcase your skills. your experiences, and professionalism. Next slide. So, so professional documents are going to include things you want to prepare ahead of time are your resume, your CV, maybe an e-portfolio, and a cover letter. And remember, that's your first impression to a potential employer. And we're going to talk more about those. This is your opportunity to showcase your qualifications, professionalism, and enthusiasm for the role. So you want to tailor these documents to increase your chances of landing an interview. Next slide. So first, let's clarify the difference in a resume and a curriculum vitae or CV. A resume is concise. It should only be 1 to 2 pages. Usually, 1 page is good because managers are looking at those. They're reading a lot of different ones, so you want to make it concise. You want it to focus on relevant skills, your experience, and accomplishments. And it should be tailored to a specific job. So the resume is not one and done. It's something that you tailor for the particular job that you're seeking. Your CV is a way for you to keep a record of all that you've been doing. And it's really nice to go back because I work on my CV at least once a week, and I'm constantly going back to gather things that I need. So it should be comprehensive. It should include everything, a detailed account of your entire academic and professional history. It's commonly used in academia, research, or advanced roles. But it's good to get it started now because you can always pull from it for a particular job. So nurses can add to their CV with each professional activity. So for example, we're doing this presentation today. This is going to be on my CV. So just, it's a good way to keep track of everything. Next slide. Next slide. Oh, there you go. So this is an example of a resume. So how to structure your resume. You want to make sure that you have contact information, a professional summary, your education, your certificates that you have, any skills. Again, this is for a particular job. So you want to talk about those skills that are relevant for the job. Your work history, and then here's a QR code for a link to some templates that are on Microsoft that you can use. And there's plenty of templates out there. It's just that these are free. So make sure your resume, again, it's structured for a particular job. Okay, next slide. And you want to maintain a CV, as I was mentioning earlier, and this is an example. It's a comprehensive history of your career. It's everything you've done. So add to it as your career progresses. You want to make sure your contact information is there, a summary statement, your educations, your certifications, your licenses, your work history, any publications, any presentations, professional organizations, all are important to be included on that. Any research that you've done, any mentoring, all those things are important to be on your CV. It's just an opportunity for you to keep track of what you've been doing. And it can add up after the years. When you're as old as I am, it's, mine's like 100 pages. So, so it's really good to keep up on it every day, every week at least. Next slide, please. And then there's a professional e-portfolio that you might want to consider. This is completely optional. It might be if you're creative and you want to do this. It's a really nice way. You can put a QR code on your resume or a link to it. It's just a fun way to show off your skills. You can link your resume. You can link your CV in it. You can give examples of your work. It's sort of like a portfolio. Well, it is an e-portfolio, but like an artist portfolio where you can give examples of some of the things you've done. You can include videos and audio components. So it is a nice way to present that. And you may I'm giving you a link to where you can go to Google Portfolio to do that if you want to do that. Next slide, please. And then you want to write a compelling cover letter. You want to make sure that you, in the introduction, that you mention the job title and how you found the position. In the body, you want to explain why you are a great fit, emphasizing your skills and experiences. In the closing paragraphs, you want to express enthusiasm and include a call to action. Um, for example, request for an interview. Some tips are to tailor each letter to a specific job and employer. You don't want to send a generic letter out. So again, you want to avoid generic statements, include specific examples, maintain a professional but engaging tone. And here's another QR code for you for templates and instructions. Next slide. And again, this is being recorded, so you'll be able to come back if you miss any of these QR codes. Some common mistakes to avoid. On your resume, make sure you don't have any spelling or grammar errors. There's so many tools you can use nowadays to avoid that. So just be sure that you don't, because that's a heads up to someone that might see a grammar error. Include irrelevant or outdated information. Again, this is your resume. There you don't want to have poor formatting or overly long documents. You don't want to send a resume that's 5 pages. Again, short and sweet and to the point. Your CV, some common mistakes would be that it's not very organized, it's not clear, or it might omit important academic details. Like if there's if there's years that are missing out of your experience, that could be a questionable area. And don't inflate your accomplishments. On your e-portfolio, make sure it's organized. You don't want it to be too flashy or not creative. You don't want it to have too much information. Make sure that it works. You don't want to have somebody trying to link to it and it's not working right. And it could lack of control over how it looks or on various devices. For example, maybe it's not working very good on a mobile app or on your phone. Make sure it's going to work in all those applications. Or maybe it's an Apple versus a PC. Make sure it's going to work in both of those formats. And also, it will take you some time to do an e-portfolio. It's not, the resume is probably the fastest one. And then the cover letter, copying content from the resume. Don't want to do that. You don't want to use a generic template without customization to that job, or being too vague or overly detailed. Okay, next slide. So now we're going to look at some job strategies. So how to find opportunities and making connections. Next slide. So it's important, the importance of a proactive job search. So even though there's a nursing shortage and we think it's going to be really easy to find a job, it may not be the job you want. So the nursing field is still competitive. A proactive approach is crucial. So you can't be, you need to stay on top of it to see what's out there. You want to align job opportunities with your career goals and your values. You want to leverage multiple resources for a comprehensive search. Next slide. So what do you want to research? You want to look at the culture, the work environment, the values and employee reviews. And you can find a lot of this information online. And it's, especially now with artificial intelligence, you can find a lot about an organization. And then what kind of patients are they serving? Are they serving mostly indigent? Or are they trauma patients? What kind of patients and services are provided? You know, it could be a private institution, or maybe you'd rather work for a teaching hospital. And what's their magnet status? You know, it's an indicator of nursing excellence. And nurses that work for magnet hospitals um, are happy for the most part. So you know, that's one thing you can look for. There's more opportunities at magnet hospitals. Are there growth opportunities, or is there career advancement and training? Um, Especially if you're a new nurse, that's really important. So some tips are to use websites like Glassdoor, LinkedIn, and hospital career pages. And you can also attend informal sessions and open houses. Next slide. So job boards and career fairs are also good places to go. Focus on healthcare specific platforms. For example, Indeed.com, Nurse.com, ANA, Career Center, and your state organizations. I know in my state, they post jobs on the Tennessee Nurse Association's website. And so even in specialty areas, they'll post jobs. So look around for job boards, set up alerts for new postings so that you know right away that something's become available. Career fairs are a really great place to go and talk to people that actually work at the hospital. Prepare for researching participating employers. Bring multiple copies of your resume and dress professionally. Again, it needs to be specific to that organization. So when you do a resume, before you go, align it with the organization where the career fair is being held, or what kind of career fair it's going to be. And then practice your elevator speech, elevator pitch. You know, and I teach that in one of my courses. You need to have a real quick summary of your skills and what you're looking for. Next slide. Networking is great. So why networking matters? Many jobs are filled through referrals. So building relationships with mentors, alumni, and colleagues, so important. And ways to network would be to join professional organizations, your state nursing association, again, FINU, your local nursing chapters, connect with alumni and faculty on LinkedIn, attend conferences and workshops. It's a great way to network. Next slide. Leveraging social media. So tips for using LinkedIn: optimize your profile with a professional photo and detailed experience. Follow hospitals and healthcare organizations to stay updated. Share articles and engage with professional content. Other platforms you can use are Twitter to follow healthcare trends and organizations. Maintain a professional image on all your platforms. You don't want your employer to go to your Facebook page and see something that's not attractive or not appropriate. So be careful with your social media. Next slide. So some common mistakes to avoid. Some job search mistakes is not tailoring your resume or your application to that job specific. Applying without understanding the role or the organization. So before you walk in the door, understand a little bit about what the organization is about and what that job is about. And then maybe failing to follow up after an application or interview. And then networking mistakes: only reaching out when you need help, or not maintaining a professional boundaries online. Those are networking mistakes. Next slide. So now I'd like to turn it over to Dr. Hazel Dennison, who will start out by talking about, well, you've got that interview, now what?
Exactly. So, hi, everybody. So, imagine you did everything Dr. Sullivan talked about. You wrote the perfect cover letter. You really tailored your resume. Somebody looked at that, where you want to work, and they said, this is a person we want to interview for this position. You get the interview. Oh my goodness. You think that that's it. That's just the start of where you have to really focus. Next slide, please. What I want you to do is think it through, and the interview consists of several different steps. First of all, you want to know your workplace. Like Dr. Sullivan said, this is a position maybe that you've always wanted, or this is a facility you've always wanted to work in, or a department you've always wanted to work in. Do you know people that work there so that you can find out some of the things that are going on? Sometimes you need to be a sleuth. Really look at that LinkedIn website, your professional image, and we're going to talk a little bit more about that. How do you make sure that you come across to that person that you're interviewing in the most professional manner? Soft skills, we're going to go over a few of those and why they matter. I'm going to tell you a little bit about licensure and credentialing, just to make sure, especially when we talk about things like the multi-state license, the compact, that you are aware of what that entails. I'm going to give you some of the common interview questions, having been an executive director and had several other titles where I've interviewed people, just so you not only get an idea of those questions, but behavioral interview questions. People are really into this nowadays, and you need to not only know, hey, that's a behavioral interview question that's coming at me, but how do I respond to it? And then evaluating offers. So let's go to that very first area. And again, Dr. Sullivan did speak to this, but know the workplace. You have an idea about this facility, check it out. Look at their LinkedIn profile. What's the president, or what's the CEO? What's the CNO? What are they discussing online, right? What have they been involved in lately? Just so that you have some idea of what's going on at that facility. So you want to make sure that you do that. You want to make sure that, say you're working with the recruiter, know who's coming to your interview, know what their names are, know what their positions are. If they just give you names, look them up. You can find out who you're interviewing with. So you have a better idea how to target that interview. And then also consider some of the questions they may ask and how you would answer them. Again, we're going to go over some of those. And then also, what are some questions that you might ask them? Nothing hurts more than having that interviewer say, do you have any questions for me? And you not having any questions to ask. That either tells me you didn't prepare, or unfortunately, like, you just didn't know what to ask about the position. So again, you didn't have a good, thorough idea of what the position entailed. The very least that you can do is ask them, are they a center of excellence for anything? Ask them if they're a magnet center, even if they already are, and you sort of already saw that online. Sometimes facilities are very proud of that status, and they might want to go on and brag a little bit about it. So it just gives you a little bit more foot in the door. Okay, so know your workplace. Plan ahead. And nothing can be said more about this than thinking about how disappointing it is that you thought you were totally prepared for your 9 a.m. interview, and then there you are sitting in traffic because you didn't think about rush hour. So then you're late for your interview, and that puts everything off on the wrong foot. Or if it starts at all, I can honestly tell you, if somebody's late for an interview with me by 15 minutes, I won't see them. Because that told me that they didn't have enough respect to show up on time for an interview. If you are stuck in traffic, what I always tell people to do is make sure that you take somebody's phone number so you have contact information and you can let them know what the problem is. So really plan ahead for things like that. Make sure that not only do you know where you're going, but what building, what room are you supposed to be in? And you give yourself time to park. There are so many facilities that you go to, parking spaces are a premium. You might have to park fairly far away from the building that you're at. So really make sure that you give yourself that extra time. lay out your outfit the night before, and not just the top and the skirt or the top and the pants, but make sure you have the shoes, make sure you have everything that you need to take to that interview. And make sure that you look at it together and you say, okay, that looks like I'm going to be put together. I'm really presenting a professional image. And then, as Dr. Sullivan also noted, make sure you have more than one copy of your resume. Although maybe the manager saw it online, maybe the recruiter saw it online, maybe you're going to interview with 3 or 4 staff people and you just don't know it until you get there. Having a resume for them to look at is always helpful. So now let's talk about, sometimes your very first meeting is not a face-to-face meeting anymore. It's a Zoom meeting. And so in a Zoom meeting, make sure that you're there early, that you introduce yourself at the beginning of the meeting. Make sure you're making some eye contact with the people that you're speaking to. Of course, at least dress appropriately. Even if it's a Zoom meeting, don't show up in a sweatshirt. Make sure your mic is muted unless you're the one that's speaking. And I really am going to speak to this one. Add a background. You see, I have a nice one here. Or blur your background. And I will tell you, I worked for a company called Medscape. And we interviewed a lot of physicians, and we were on Zoom calls with a lot of physicians. And here I am interviewing 3 different physicians, and I'm talking to them. And mind you, I live on a very small lake in a small community, but behind my office is a whole set of windows where you can see the lake. And I'm talking with these physicians, and I don't have their attention at all. It only takes me a minute to realize that 2 of the teenage girls are actually paddle surfing past my window as I'm trying to interview these 3 physicians. And so really a background, blur your background, that can happen, but there's so many people that can walk past. You want no distractions from that Zoom meeting. Oh, and one more thing, don't be on Zoom thinking that you're speaking to one group and have email up on a different screen, or not be multitasking where you're looking at more than one thing and expecting that they're paying attention to you. Next slide, please. And next slide, please, Sarah. And next slide. Sorry, I didn't ask to change the slides. Okay, next slide, Sarah. All right, your image. So when you're looking at interview attire, you want to look like you're going to be professional. A suit jacket or something where you know your office casual, but not like you're going out to a club. Not where you have on a lot of jewelry or you just don't look like someone that's going into the office to actually do work. Okay, so dress appropriately for the position. Don't wear jeans, sweatshirts, flip-flops. These are the sort of things that might put off a potential employer. No strong perfume if you're a female, or no strong cologne if you're a male. Be mindful of your habits. Some people get very nervous in these sort of situations and their leg starts to twitch, or they have to play with their jewelry. These are habits you really want to try to control. And it might mean like having your hands together in your lap, but these are the sort of things and the sort of signals that the interviewer is going to look at. Make sure that you can ask questions. So they're going to hopefully make you feel a little bit more comfortable about the position, but be ready to ask, what are my hours? A little bit about the workload, the acuity of the patients on the floor, what the floor support looks like. But again, make sure you arrive on time or early if you can. Next slide, Sarah. Oop, I'm sorry. So now let's talk a little bit about soft skills and why these are important. These skills really do help to propel you to the top of that, I want that nurse. list. So try to mention one or two of these in a few of your interview responses. When we're talking about problem solving, communicating effectively, critical thinking capabilities, how you manage your time effectively, how you work as a team member, your leadership skills specifically in different situations, or how you creatively solved a problem. These are the skills that managers and even those recruiters are really looking for. And you can see my picture of the office there, but I kind of felt like Jim was that person that had a lot of those soft skills. If you've never watched The Office, then you don't know Jim. But next slide, please, Sarah. Okay, so let's talk a little bit about licensing and credentialing. Of course, you're going to look for those basic certifications. Make sure that they are on your resume. If you have your BLS, make sure it's there. Your ACLS, make sure it's on there. PALS, if you're looking for a pediatric area. Always, these are really important. I do want to stress that if you are looking at an advertisement for a position and you don't know the credentials they're asking for, they say you have to have a CMMS, look it up. You don't have a CMMS. How long would it take you to get one? If you really are interested in that position, and would that position be willing to take you if you said, okay, I don't have that, but those are credentials I'm willing to obtain for you. So always consider making sure if you don't have that certification, can you obtain that? And I'm at the very end of this presentation, I have a link to a site where it has all the certifications, and then it also takes you to how you obtain them, the body that offers them. Now let's talk a little bit about your state licensure. So we know when you initially get your RN license, you're sitting for NCLEX, then you apply to the state, you get your RN license. Nowadays, because we have compact states, right? And we have more than 40, 43 of our states are compact states. You submit your application and you get licensed. But what I want you to think about is now, if you're a new RN, you may automatically get that compact license or that multi-state license. If you've been an RN for several years in that state, and it was before they were a compact state, you might not meet the criteria to have a compact license. And so you need to go to your state. Don't just think that you have, because you're in a state that is part of the compact, don't just think that you have that multi-state license. Chances are, unless you're a new nurse, you do not. And you need to apply separately for that multi-state license. It's probably a separate fee and a separate waiting period. So nurses, if you've been a nurse for, I would say even 5 to 10 years, or you've been in your state before your state was part of the compact, go back to your state and look and see if you have a multi-state license or just a state-specific license. Okay. I'm also going to say advanced practice licenses. When we look at those, there are essential elements called the LACE, where we're looking at licensure, accreditation, certification, and educational preparation. And while that's really beyond the focus of this presentation, make sure that if you're looking at that advanced practice license for your state, that you're looking into all 4 of those criteria and you meet them. Okay, Sarah, next slide, please. The first 5 minutes, when someone comes into my office to be interviewed, I look at them and I'm going to tell you the first 5 minutes are what really makes me know this is somebody that I really have a great deal of interest in. And they're going to ask you for some information, and they get a lot of information from you. Are you on time, or are you timely when you come to to be interviewed, that tells me you have respect for me, you have respect for the organization. Your body language. Do you look nervous in this interview? Or do you look like someone that's really interested in this interview? If you're argumentative or you contradict the interviewer and you say, well, that's not how I see it, really don't do that because you're setting yourself up on a bad foot with the interviewer. A lot of times the manager might offer you something to drink or coffee. Know that sometimes it relaxes you to know that you have something to drink in the background. Sometimes you get really nervous because you're jittery. You don't want to be trying to drink that coffee if you're jittery, and just decline the coffee and wait till you're done with the interview. When you're asking about salary and benefits, do that with the recruiter, not the nurse manager on the floor. That would just not be a good setup for you. Always the recruiter is going to be the one that you go to talk about those salary and the benefits. And whatever you do, make sure it's only you at the interview. You don't need to bring your spouse, a significant other, uh, or children to your interview. Next slide. So sometimes we ask common interview questions, and we're going to ask, especially newer nurses, what areas of nursing are of interest to you? Do you like days? Do you like nights? Tell me about your clinical experiences. Which rotations did you enjoy the most? But then we're also going to ask nurses that have a little bit of a background. What qualifies you for this position? What makes you think you'll be successful in this position? That's where some of those soft skills come in handy, right? I'm a team player. I'm really organized. What qualifies you? You're certified in this area, or you're looking at becoming certified in this area. What are your future career plans? And again, back to Deb Sullivan and what she told you. Really prepare for what do I want to do in 2 years? What are my goals for the next 5 years? Any good manager is going to want to know, and they're going to want to ask you that information. And how do you handle stress in the work setting? That's always an important question. And again, back to those soft skills. Tell me a little bit about yourself. This is where I don't want you to get tripped up. When a manager or the recruiter asks you to tell them about yourself, they want to know more about your professional personality, your professional life. But a lot of times we get focused on our personal life. Well, I'm married, I have 2 children and a dog, and I do this. That's not something that you need to discuss with the recruiter or the manager. You want to tell them what your professional goals are, what sort of CE activities you attend. Are you planning on returning to school? Are you in school? Do you sit on any other nursing associations? What do you participate in? Those sort of professional activities. That's really where you want to focus that question. Next slide. So here are some frequently asked questions from employers. So when they start to interview you, first, let's hope that they're going to make you feel comfortable, have you sit down, relax a little bit, kind of maybe do a little icebreaker or whatever, tell you a little bit about themselves and the floor. But what I want you to think about is some of the best questions I've always asked people are, tell me 3 of your strengths, or tell me 3 of your weaknesses. If I was to ask your last boss about you, tell me 3 words that they would use to describe you. Tell me a little bit about where you've worked in the past. Now, when we get into things like, what would you do if? These are questions where we're starting to look at behavioral interviewing. And so we're going to go into that in a little depth in a few more slides. But what questions do you have for me? Never leave that interview without having questions that you ask the employers so that you show interest in the organization, where you're going to work, that there's something that you want to know about that floor or that facility. Next slide. Okay. So here's some questions that you could ask. Can I see the position description? How many patients are on this unit? Do you have any specialty focus? Now, remember, once you get there and you really start getting into a conversation with the manager, you can always change up the questions, but just have one or two in your back pocket so you're ready. And then if you have nothing else and you know their magnet, they've already talked about their magnet or their baldridge. Can I tour the area? Can I see the floor or can I see the area I'm going to work on? This is always a great one because now you get to see what the unit looks like. Are the nurses smiling? Are they talking to each other? Are they talking to the physicians? How collegial does that floor look to you? And that's where you can get a real good idea of how the flow is on the floor. And so I always recommend that if you can't think of any other questions, ask them to tour the facility. Next slide. So let's go over, you're going to know it's a behavioral interviewing question because it's going to be a situation. What would you do if? Tell me about a time. These are that start of that behavioral interviewing. What I want to do is give you the answers. How do you answer these questions and how do you make it work for you? And so this is the STAR method. When you know that it's a behavioral question and you see it coming at you, what do you do? So first, look at it as the situation. The situation is explain the background of what the problem was, outline the problem, but don't go into great detail here. Be clear and concise. The task, what was your role? What were you responsible for? And again, be clear and concise, keep it brief. Now, when we talk about the action phase of the STAR, describe how you overcame the challenge or were able to appropriately address the situation. This is where you need to provide that detail, where you wanted them to know what you did and why. It's really important that that action be really nicely detailed. And the result, share that outcome, be specific. Okay, so now what we're going to do is we're going to go over a couple of these stars and give you some ideas. Next slide. So the first one is tell me about the best or worst day that you've ever had as a nurse and what made it the best. So let's think through what that situation would look like. S, make the situation about patient care or quality care. T, what was your role? You saw yourself as attempting to provide or improve the care. Do not make it about things like breaks or you're short-staffed. That all, again, puts a negative spin on the day. Okay. A, what were your actions? What were you able to do to improve the situation? And then R, what were the results? Next slide, please. So we're going to go through one and I'm going to go through all the parts of it just so you get a good idea of how would you integrate that STAR method into a behavioral interview question. So imagine that the manager asks you, what professional achievement are you most proud of and how did you accomplish it? So I'm going to give you one, ask the situation, and it's just because I'm a nephrology nurse and my heart and background. We had a patient in renal failure after a AAA repair. We attempted dialysis. However, the patient's blood pressure kept dropping, even though he had more than 30 pounds of fluid on him. That's the A. That's the S, the situation, right? So now let's look at what's that T, the task. I already knew how to do this very special procedure that was gentler on the body than conventional dialysis. And I spoke with the nephrologist about trying CRT on the patient. That's it. That was the task. A, the action. We spoke to management and provided education to the nurses that would be on for the next 48 hours, and worked with the surgeon to initiate the CRRT. I was with the patient and the ICU staff and educated them, as well as the renal fellows, on what we were doing and how it worked. I came to see the patient every 12 hours, and so did the nephrologist. We kept in close communication with the patient's family and the staff and made changes as the patient became more alert. So you can see the detail that I put into that action phase. And it's a little harder when it's just like off the cuff, you have to come up with it. So understanding that star ahead of time is really going to be helpful to you. And then the result are, we did a huge collaboration with all the other physicians and nurses, nephrology team members. And after 4 days, the patient started to become stable, and we were able to take him off of CRRT and actually initiate regular dialysis. He only needed it for a few weeks, and then he got better. And so you can see that that is a professional achievement. I implemented the entire STAR, but I really focused on that action piece so you could see what I was capable of doing. Next slide, please. So now's where you guys get to use your little chat feature here. We're going to walk through a STAR method together. And I'm going to start it, and I'll tell you where you guys get to come in. And we're going to do a behavioral interviewing. Tell me about a time you disagreed with a coworker. How did you resolve the issue? So let's walk through it. And the S that I'm going to give you is you and a coworker were double checking each other on the dose of heparin that should be administered in a heparin drip. The patient had a PE and the anticoagulant had gone up several times in the past few hours. T, you and a second nurse both calculated and got a different number. The second nurse said, let's just go with your calculation. You know, I'm bad with numbers and math. So here's where you're different, right? Because you don't want to do that. And so action, if you don't want to do it and the nurse doesn't want to, she just wants to go with what you said, what kind of action would you in the chat consider to be an appropriate action that you could take to resolve this disagreement with a coworker satisfactorily? What could you do? I don't know if I can see the chat. Let me see. There you go. Ask another nurse to verify with me. That's a really good response. Let's check up. Let's check and go over the orders together. Right. Double check with the third nurse or call pharmacy. Wonderful. Call pharmacy. When all else fails, call pharmacy. Recalculate together and show why they got different numbers perfectly. So what you're doing here is you're coming back together. Although you disagreed with her, you look for a better resolution to it. And so in the end, double check together. Yes, you get a good result, and you're able to come to a conclusion where you have the patient appropriately anticoagulated, and the second nurse and you were successful in working together and developing a good resolution to the problem. Okay, so hopefully that STAR method makes a little bit of sense to you now. I'm only on slide 40, so let me go faster. So key points to remember. Next slide, please. Okay. Really, when you're looking at things, be humble, answer questions honestly, don't brag or gloat, don't criticize past employers or instructors. It doesn't look good on you. Don't dwell on shortcomings. Just look at it as an, this is a place where I could get better. Next slide, please. Be observant. Again, if you're meeting with somebody, look around at the environment. Are the nurses smiling? Are they looking at each other? Do they say positive things about each other? Do people acknowledge each other as they walk down the hallway? Look at any in-house publications that are laying around. Okay, next slide, please. After the interview, you want to sometimes do more than one interview, do a couple different interviews where you're able to look at what are the different positions that are being offered to me. What is the salary and the differential? I'm going to tell you, even if you're in 3 or 4 different hospitals locally, the salaries, the benefits may differ. Who's going to pay for schooling? Any additional pluses that they might offer? Do you get a work from home day every now and then? So also think about things like your preceptor. How do they match you with your preceptor? What is that transition to practice program for new grads? Or what is that orientation if you've been a nurse for a while? What kind of support do you have as you move into the position? You don't want to just survive, you want to thrive. Next slide, please. Okay. Job offers and rejections. If you know you don't want that position, be honest and say, I'm so impressed that you offer me the position, but it doesn't quite fit my needs right now, and decline the position. Don't leave them hanging and waiting if you know that position wasn't right for you. Avoid being pressured into saying yes. You're so excited because somebody offered you a position, but it might not be one that you should accept. And you sort of know whether or not you should say yes or whether or not you want the position. Next slide, please. Red flags. If you're looking at a position, always ask them, how long have some of the people worked here, right? If there's a high turnover rate, you want to know that there's something going on if a lot of nurses come and they leave. If they don't have a clear position description for you, is one being created? If you're trying to schedule with that manager and they're constantly rescheduling, what's going on that they don't even have time to interview you? If that manager talks badly about other team members, you have to worry that is she also going to disrespect you or other nurses that way? If they ask you uncomfortable questions, and I'll get to that in a slide or two, employers, they look at you as well. If you were unprofessional during the interview, if you have poor communication skills, if you weren't prepared, if you're dishonest, if there's gaps in your employment history and you can't explain them. And we'll also go over dishonesty in just a second. Next slide, please. Beware of. Okay. The first one, the nurse manager's interviewing you and asks you, are you planning to get married and start a family soon? Know that they're not allowed to ask you questions like that. They're not allowed to ask you about your personal life, only professionally what's on your resume or what you're talking about. If you open that door, and you shouldn't, then that gives them the ability to discuss it further. So don't open that door. Second one, if you're interviewing for a position on a med surg floor, seems like a good job, not exactly what you want, but the days are good, the money's good. The nurse manager tells you she's tired of new nurses quitting and she wants you to promise to stay for at least a year. Know that if you have a promise for a specific period of time with no commitment in return from the facility. So if they're willing to pay for you to go to school and they want you to stay a year, then they're giving you something for you to stay. If they're not giving you anything, they just want you to promise to stay, that's really not something that is allowed to do. They're allowed to do. And so you should never promise to say and just say, I'm really uncomfortable doing that. And the third one, you're interviewing for a really great job. You personally know the assistant nurse manager, and she tells you that if you have a background in emergency room nursing, the nurse manager is really going to love to see that on your resume. She tells you to put it on your resume, but you don't have that background. Do not add it. If you falsify your resume with any information that's not true, know that that can be cause for firing you in the future. And so you don't want to falsify any records because you don't want to come into a situation with the wrong pretense. Next slide, please. And just remember, there is always reality shock when you first start a job, even if it's the job you wanted and you work so hard for it. Once it's a daily position, the realities of what the work are and what the responsibilities are can really become overwhelming. But I will tell you, the grass isn't always greener, and you really don't want a job hop if you can avoid it. Uh, it can be frustrating, but no, you can come out the other side and be happy. So just know that there is reality shock. Next slide, please. So these are honestly some things that have been said to me during interviews. So hopefully you're all in the background chuckling. I personally was told, I can save us both a lot of time here. Just tell me what the salary is and what my overtime rate is, and I'll tell you if I'm coming or not. Um, I I can't work overtime here because I have to get to my real job. My favorite was, how long do I have to work before I can take a sick day? So really think twice when people ask you, hey, do you have any questions for me? Make sure that these aren't the answers that you give or the questions that you give. And next slide. Oh, hold on, where's the references? Are they the last one? Okay. So here I will tell you, we have some great references here, resume templates, how to build that e-portfolio. And that last reference is the Walden University Hub. That Walden University Hub actually has every certification and every certifying body listed and what the requirements are for all the certifications that I've ever seen and so many more that I haven't. It's really rich in details for you. So if that's something that you're interested in, please consider looking at that link. And I think that's the end of the presentation. I hope you enjoyed it.
I know we're a little over time, but if anyone has a question, feel free to put it in the chat area, and we can stay a few minutes and answer.
I'm also working on getting everyone unmuted so you can speak. And please note that within 24 hours, you'll be getting an email on how to redeem your certificate for attending today's webinar. Everybody should be able to unmute if you have questions for our speakers.
Hi, my name is Jenny. I do have a question. I did start to put it in the chat. What if you do have job gaps because of a disability? How do you handle that?
So I prefer to be honest and say I wasn't feeling well in this time frame, and so I did not have a position, or just I wouldn't go into a great deal of detail, but just I did have some difficult times and wasn't able to work in a position during these years. And I'd be honest with them and tell them up front, whoever I was working with and saw the resume, because I do feel like honesty is better than not being honest, especially when it's something as important as a disability that you had or still have. So yeah, I would definitely make sure that they were aware that that was the reason for the gap in time.
That's exactly what I was going to say. I think you just need to be honest. You don't have to give details.
Mhm.
Just be honest. You could even include it on your CV or your resume. Just if you want to address that time break. There's a question. You will get a link in the email. Oh, I guess that's from Sarah. She's sending out a link. Any other questions? Jenny.
Yes, I have quite a few questions, but I'll try and keep this one short as well. When you're doing the CV and you've had like a career that has a lot of twists and turns before nursing, but is all really pertinent, do you include that in the CV? Like, for example, I, started as a camp counselor, but worked for that summer camp in 15 different roles and then leadership positions and things like that. And then I worked as an adjunct college instructor, but it wasn't in nursing. Do I include all that?
Yes, you can include all that in your CV, but when you do the resume, don't include those things unless it's applicable. For example, I mean, your past experience will contribute to your role as a nurse. I mean, I'm sure that some of the things you did as a counselor or as a professor would add to your ability to be at whatever position you're applying for. I think included on your CV. Again, it's about being honest. Yeah.
Mhm.
Did you have some more questions, Jenny?
Um, on the resume, some of the styles I have seen, put like lumped. I've primarily done psychiatric nursing, and
Mhm.
it's lumped all those together, so that it wasn't a time oriented resume. Is that really an acceptable format?
Uh, yeah. I like to see the times on it. Hazel, what's your thoughts?
Yeah, I want to see times, dates, and the reason for that is many. But the one thing that you do want to, if they just say I was in mental health nursing and these are all the positions, the problem with that is, okay, were you in this position for 10 years or 10 minutes? I'm not seeing what you did. Um, where you worked, how long you worked. I really tend to get nervous when people only are in a position for 3 or 4 months and then they move on to another position and they just job hop. And so I do like to see, I was in this position, I grew, I took a position as a charge nurse, I took a position in management. Like you can see the progression in positions and over time. So yes, definitely with dates and
Okay.
times.
All right. Thank you.
Mhm.
Sarah, I think Kristen has a question for you.
Already answered. The certificates come directly from the international office. I've put a phone number in there for to call. Hit option 1. That'll get you to our membership services, and they'll be able to help you with your certificate. And I'm not sure when you got inducted, but it takes up to 10 weeks and longer with the snail mail it goes through.
Were there any other questions? Jenny, did you have another question?
Yeah. When I've been I'm going into my working for my psychiatric nurse practitioner currently.
Mhm.
Great.
I have done many jobs, multiple simultaneously in many different areas, but I keep very busy. And one of the questions that there's different feedback on, tell me about your weakness. I have been told and read to be honest about an actual weakness and how you came out on the other side. But then I've also been told um, to figure out what weakness is actually a strength to the employer. What are your thoughts on that?
I'll take it.
Okay.
So
Yeah, I was just gonna say
I
I get
love,
so tired of hearing the same answer.
I'm
People I study
the,
too hard, or
I'm the strengths and weaknesses person. I love to hear that. So when people ask me, tell me about a weakness, I try to make it a great weakness. So one of my weaknesses is I have a hard time saying no. And so, yeah, it's a weakness, but it's also a great thing for an employer. Or sometimes I feel like I'm too honest, I'm too upfront. Again, I like to help. I like to help, and I have a hard time letting other people do things for themselves. So it is a weakness, but it's a weakness that also makes you look good, so to speak. So those are the weaknesses I like to see. Weaknesses that I don't like to see are things like I have a hard time working with people. Don't do it because like if you're on a floor, if you're on a team, it doesn't look good for you if you tell people you prefer to work alone. Um, or you don't like to work with people, then you're not a team. You're really negating all those soft skills that I told you employers want to see. So you want a weakness, but you want a good weakness, if that makes sense. Um, I love to educate patients, but sometimes maybe I tell them too much information, or I like to go into detail when I educate patients, but maybe it's too much detail. So again, like, yeah, it could be a weakness, but as an employer or as a manager, that's one of those weaknesses I want to see. If that
But
doesn't
also
help.
think about how you overcome the weakness. I think sometimes, it's, like for me, I have a hard time saying no too.
Yeah.
But I try to use a calendar, so to follow it up with maybe, some ways that you overcome a weakness.
Whoop.
Does that help, Jenny?
Yes. And then the very last question I have is, where do you put your practicum experiences on the resume?
Your practicum experiences on the resume. It depends on, like, I mean, so you're going to be graduating and you want to put it on your resume because you're looking for a particular job, correct? Is that right?
No, not quite yet. I've done one practicum out of the 4, and I'm trying to find a preceptor for my second practicum. Do I include the first practicum on the resume, or that doesn't go on the resume?
So I have my students put it on there, and basically, I like the education piece to be front and center. That's got to be first. Under that, because now you're saying you're in an MSM program, under that, I would put like a little subheader that said practicum experiences and then work experiences, especially because it's going to flow right from your education to the practicum experiences and then to your work experiences. So like it just flows on your resume.
Okay, thank you so much. I really appreciate both of your help.
Well, thank you for the questions. I'm sure other people had the same ones.
Okay.
Anyone else? Okay, well, thanks everyone. Sarah, you want to, do you have anything?
Take it over, Sarah.
Yes, I just want to thank everyone for coming tonight. You will get an email from myself with instructions on how to watch the webinar or go back and make references to it, along with how to claim your certificate for the NCPDs. I still want to say CEs because it's just so much easier, but we're growing and changing as nurses. So I hope everybody has a great day. Look out for the next webinar that we'll be setting up, or if you have work that you'd like to share in this format, please reach out to me. I put my email in the chat, and thank you again to both of our speakers. It was an outstanding presentation, and I know as I'm getting ready to graduate myself, I'll be using some of these tips moving forward. Have a
Bye.
great day, everybody.
Thank you. Thank you all.
Thank you.
Have a great night.
Bye.